What's your name? Tasneem, welcome. Is it okay if I examine your cranial nerves today? That means the nerves from your brain.
Yes.
Do you have any pain?
No.
Okay, so just to begin with, I would ask the questions of the mini mental state exam. So I'd just ask her the name, the place, the date, ask her to obey commands, things like that. And then I'd also be listening to the sound of the voice, to speech, whether she's talking appropriately and normally. And then I will start examining each nerve. So first of all, have you noticed any change to your sense of smell?
No.
No. Have you noticed any change to your vision?
No.
No. So I would ask the patient to look afar and read one of the boards to be able to see the letters to check her vision. Then I would ask to see her response to light for her pupils. So I'm going to shine a light in your eye. I'm sorry, it's a little bit bright. If you want to just look ahead, so I shine the light to see the constriction, and I'm looking in the eye that I'm shining the light in and the other eye. And the pupils should constrict. Then I'm going to move the light between each eyes for the relevant afferent pupil defect to check that both eyes are still constricting and that one doesn't seem to dilate. Then I will check convergence, accommodation, look at my finger, keep looking at it as I bring it closer. And as I bring my finger closer, again, her eyes should constrict. So that's through the parasympathetic nerves on the third cranial nerve. Then I want to test for eye movements. So I'm just going to hold your head so you don't move your head. If you look at my finger, how many do you see? One. Okay. I'm going to move my finger. Keep looking at it. Tell me if you can't see it or you see more than one of it. Okay? So, yes, move with your eyes. So keep looking with your eyes. So I'm testing up and down and side to side. So I'm testing the third, fourth, and sixth cranial nerve. If there's a problem with the fourth cranial nerve, she'll have double vision, especially vertically, and the sixth cranial nerve, she'll have double vision laterally and won't be able to move the eye to the side. Then I would test for the fifth cranial nerve, so I'll test sensation. So if you close your eyes, I'm going to test on each side. Can you feel me touching you?
Yes. Yes. Yes.
Again, the other side.
Yes. Yes.
So I'm testing, you can open your eyes. So I'm testing in the ophthalmic, the maxillary and mandibular divisions. And then for the motor, can you clench your teeth together? Okay, and feeling the strength of the clenching your teeth, and open your mouth. Okay, testing the strength of opening the mouth. Then I'll test the seventh cranial nerve, so that's for facial expression. Can you raise your eyebrows? And checking that both sides are moving. If there's an upper motor neuron problem, then both sides are innervated, so both will still be okay, but one side won't be okay lower down. If it's a lower motor neuron problem, then the whole of one side of the face will be affected. Can you blow your cheeks out? Very good, and smile for me. Very good, thank you.
Okay.
Now I'm testing the eighth cranial nerve for hearing. I'm going to rub my fingers in by one ear so she can't hear so well, and just whisper a number the other ear. What number did I say?
71.
71. And again, I would check the other side. I don't today have a tuning fork with me, but I would do Weber's test where I'd use a tuning fork and place it on the forehead and ask where the patient hears it loudest. Is it loudest in one of your ears or in the middle? And it should be loudest in the middle. Then I will do Rinne's test where again I use the tuning fork. I will place it in front of the ear in the air and then on the mastoid process and ask which is loudest. Again, it should be loudest in the air. If it's loudest on the mastoid process, then there's a conductive deafness. Then I want to test the 9th and 10th cranial nerves together. Ask the patient to open the mouth and say ah. Open the wide? Ah. Okay. And I'm looking at the uvula to see if it moves to one side or not. If there's a problem with the cranial nerve on one side, it will move away. It will move towards the normal side, away from the side where there's a problem. Then I will test the 11th cranial nerve by head movement. So look that way. I'm going to push against your hand, my hand, look this way, push against my hand, push, and then shrug your shoulders and keep them there and push them down. So sternomastoid and trapezius strength. And then the 12th cranial nerve, testing for the tongue. Can you stick your tongue out? Thank you, move it from side to side. Okay. And if there's a problem, for example, on this side with the 12th cranial nerve, the tongue will move towards the side of the problem. And that's the cranial nerves. Thank you very much.